thank you for all of you for joining us this afternoon. We're going to have our presentation shortly. A couple of things I want to bring to your attention. First is we're having a virtual conference on May 21st at 1 o'clock. So I want to alert you to that and make sure you register for that. We're going to have a keynote address that would have been our keynote address at our conference. The title is called Pivoting to Your Purpose. Carith Foster is the presenter, and she'll be presenting to us, followed by lender or business members are going to talk about some of the solutions they have for dealing with this pandemic that we're in. Then we're going to have a virtual town hall with LeadingAge National to talk about, where does this take our field to the future? And then we're going to have a virtual happy hour, virtual facilitated happy hour. So I want the opportunity again to share stories. And so make sure you look toward in our chat box. We'll get our registration information up there, and we'll resend all the registration information to you. So just want to make sure of that. And then next week, our call will be a presentation by Ziegler, who a lot of you are familiar with, talking about sort of the state of the field right now financially. So make sure you plan on coming on the call next week as well. So it's my pleasure to, as far as later today, following our presentation, we're going to take Q&A. So I want to make sure that if you can do it in the chat box. If you have questions, it's probably best to put it in the chat box, but obviously if you want to unmute yourselves and ask those questions, you can do that as well. So it's my pleasure to present Haley Mosley, who brings us over 15 years of life enrichment experience to her as manager of life enrichment at CC Young. She has worked in all levels of care with a specialization in technological advances, large group events, and person-centered care. And proud to say she's also a graduate of our Leadership Institute. So Haley's going to talk to us about dealing with isolation which all of us are dealing with, but particularly with residents. So Haley, take it away. Let me unmute you. Take it away. Let me unmute you.
All right, I'm hearing some feedback.
Yeah, there we go.
Okay. All right. Well, hello, everybody. Thank you so much, George. I am Haley Mosley, Manager of Life Enrichment at CC Young. This presentation was put together through Active Times Consulting as well. So I consult with them from time to time. So what we're going to be looking at today is the way we can connect to family members, to residents, to one another during these times of isolation. Everything is different, everything is changed, and we really want to look at ways that we can improve the lives of our residents and increase the skills of our staff members during this time. The first thing I want to look at is the positive psychosocial outcomes. If we look at Maslow's hierarchy of needs, the third tier is for love and belonging. And that's something that most of the facilities are doing really well. But during this time of isolation, that large group feeling of belonging, that interaction with other residents of their peer group, it's not happening and it can't happen. So how can we continue to meet those needs? The real trick is the one-on-ones, that one-on-one time between a caregiver and a resident, between a resident and an activity professional, between a resident and a family member. Those one-on-one times are our main tool to create that sense of love and belonging. Research has actually shown that the one-on-ones show far more benefits than any other group activities. It's also been studied that only 30% of group activities actually connect and give that sense of love and belonging to the residents. So 70% of your residents should have those one-on-one connections or those opportunities outside of large groups to connect to others. So with all this, we should see some more flexibility in scheduling. And this is even after the isolation is over. Some of the things we're seeing right now is some of the residents that have never come out of their shell in group activities are now becoming more outgoing. They're getting more involved emotionally with the staff. That's a good thing, good side. So after this is over, you should still see your activity professionals having more flexibility in their scheduling and providing more times for those one-on-one interactions, which are so vital to the residents' psychosocial well-being. I also have a link here for the Meaningful Engagement project that was created through HHS. If you go into the learning portal, you'll find a 4-hour CEU for caregivers to talk about how to make each interaction meaningful. And so, yes, your CNAs, your nurses don't have time to take an activity basket into a resident's room and sit with them. But when they're giving their shower, they can make that a meaningful time. They can use strategies to connect to the resident in non-caregiving ways, not make it so clinical, but actually make those experiences meaningful. When they are assisting them in dining, they're making that time a time to connect with the resident, which will improve their eating. So this is a great opportunity through HHS for a free 4-hour program for caregivers. So when you're looking at a resident psychosocial engagement and the resident's involvement in a community, when I ask you guys, what would you want the staff at a senior living community to know about you? What are the things that they absolutely have to know? The number one things you're going to say are, I want my coffee in the morning. I like to take a bath in the evening. I want to read the newspaper. Those are down at the bottom with daily habits and lifestyle preferences. That is the bulk of what we should be doing with our residents. And that is an all staff, all hands on deck. The second one is interests and social-based groups. Those are your small groups. Now, some of you still have those going, and most of you probably don't, but we can continue to do that through bringing those interest groups into your programming, which is mostly going to happen through your life enrichment department. And lastly, those special seasonal themed recurring events, your parties, your birthdays, your Christmas, those should be the smallest segment of your activity calendars that you should see your activity professionals engaging in, because those are the things that our residents are looking for the least. Number one thing is those daily habits and lifestyle preferences, which mostly happen through one-on-one interactions and engagement. One thing we're seeing right now is increased family relationships. I know families aren't allowed, but we're still seeing increased time with them. Right now, your staff is Skyping, FaceTime, Google Meet, all these things with residents and family members to help bridge that gap while they can't come into the facility. But let's think about 3 months ago. When a family member came into the facility, they would go into a resident's room, they'd shut the door, and they would do their thing. You'd see the family in a care plan. We all have those families who you see all the time. Every time they come in, they have to come talk to you. But what about the others? We don't know what they're doing as far as social engagement. We don't know what they're talking about. We don't know what stories they're telling. Well, now with the technology that's increasing and us having to do these virtual visits, you have a staff member sitting there between a resident and a family member who can help create times for you to learn more about your residents. We all agree person-centered care is the way to go, but you can't do person-centered care if you don't know the residents. So I have had an issue with some family members when they're doing those Skype times that all they can think to talk about is COVID and isolation. Well, yes, we want our residents to understand that the reason their loved ones can't come is because of quarantine, but the residents don't need to hear the stats about how many people have died and how the morgues are overflowing. And I've sat in a conversation where that's what the family member wants to talk about. And we need to intervene in that to protect our residents and find a professional way to say, let's change the topic here. And now the activity director or the person leading that Skype message can say, tell me how you met your husband. We know the data, we know the facts, we know what they did for a living, we know what school they went to, we know how many kids they have, but what we don't have are the stories. What did you like to do when you grew up? Tell me about playing baseball. Tell me about the things your mom would do with you. Those stories are better sensors for how to connect with these people than these amazing, wonderful people that we get to serve, better than a list of qualities. So family members are also more willing to communicate. We're giving them something to talk about. At home, they're sitting and wondering, missing mom, how can I help her? How can I do something for her? This is a great opportunity for us to be asking those family members to fill out history and biographical information. Sometimes upon admission, the family doesn't want to fill that out, not because they don't want to tell us, but because they're so focused on the legal aspects, selling mom's house, dealing with the guilt, all those other emotional issues, all those legal issues, all the contracts, all that kind of stuff. And they don't have the time to sit and talk with us about those social and emotional history and biographical information. So now we need to pull out those forms and start sending them to them and making that phone call. Hey, I would love to hear more about your family member. We know some of this stuff, but we would love for you to fill in some gaps that we have for us. But the second step of that is we have to make that opportunity to learn these things available to all staff. Most of the time, this is going to lay on the shoulders of your life enrichment activity professional to be able to share that information with staff. We need to be putting these in the care guides, hanging this information in their room, announcing this at their birthdays. We need to have that information shared because we can get that information all we want, but we have to share it with the rest of the team so that we can have those meaningful engagements where we talk about how to give the resident that sense of love and belonging. Another thing we're seeing right now is increased technology. If you don't have an in-house TV channel, there is a link on the National Council for Certification of Activity Professionals website called NCAP. And there's a link to tell you how to create an in-house TV channel with a laptop, an adapter cord, and a media room. So if you have cable in your room, you can take away one of those channels. A lot of facilities are taking away cartoon channels and giving them an in-house TV channel for free. That's available. So everybody should be doing that. The technology's out there. The links are out there to teach you how to do it. You just need some willing staff to make it happen. So when we're doing that, we're seeing some cross-campus connection in our CCRC Life Plan community. We're able to do events across the whole campus, not separating memory care in one group, long-term care in one group, independent living in another group. Everybody's doing the same thing together, and it's giving us a sense of belonging to the community of CC Young. One thing is out-of-state family. Now that your staff all knows how to Skype, going forward, we're going to be expected to do it more often, especially with those out-of-state family members that want to be involved. Another thing we're seeing is free resources are exploding. There are tons of things coming out for your residents to be engaged, to watch, to learn about, to listen to, and those are not going to go away. Those are all going to be archived, and you should continue to see those being utilized. So you will see an increased technology in your community just because we've been forced to use it. Virtual volunteerism is another thing we're really going to have to be thinking about because it's going to be a long time before volunteers are going to be asked into our community. We need to be finding ways for them outside to be helping us inside. What packets can they make? What games can they build for us? One of the things I was talking with them earlier is to have a volunteer watch a video, one of those free resources, a YouTube video, and then create a discussion guide. And then send that link and that discussion guide to your activity professional to be able to utilize that video immediately, not have to proof it, because if you don't know, activity professionals have to watch every single video before they show it because you never know what's going to happen at the end. So you're going to see more opportunities for that virtual volunteerism. We're also considering things like flip volunteering, where instead of the volunteers coming into our campus, sending a designee from the facility out to the corporate sponsor, the corporate volunteer group, and having them do a Zoom call, a Skype call, a GoToMeeting where they are doing something there. So Family Feud, for instance, the corporate volunteer group is playing Family Feud, and your memory care community or unit is playing Family Feud, and then they're going to compare answers and see which wins, the corporate volunteers or the residents, and we can kind of tailor those to the different audiences that we're doing. So virtual volunteerism is going to change. We're going to see a lot more reasons for the volunteers to stay out of the community instead of coming into the community. Another idea with that flip volunteering is sending a representative to go Skype at a choir concert with a bunch of third graders. Wouldn't that be awesome to bring that in, but you don't have to have 50 third graders with their runny noses in your building. So there are a lot of opportunities coming out right now that we need to be taking advantage of to bring the meaningful engagement to our residents. We have increased family relationships. We need to be communicating to these family members, not only about the legalities and what we're doing as far as restrictions and prevention and all those policies and procedures that we have to communicate, but also that social level, that interactive, that meaningful connection. How can we get your family better connected to our community? What can we learn more about them? And with that, we'll see more positive psychosocial outcomes. Those one-on-ones are the most important thing for your activity professionals and your caregivers to be doing right now. Connecting with a resident in a meaningful way that makes them feel validated, makes them feel human, makes them feel like they are really loved, cared for, and acknowledged as a person, not just as a patient. We'll see increased technology coming out because we're being forced to do it, and that technology will not go away. We're seeing a new normal, you guys. Things are not going to go back to the way they are, and we all know that, but this is going to affect every single department, including your life enrichment department. So when you see those calendars come out from them that shows one-on-ones 3 days a week, don't be surprised. Encourage that one-on-one time because you'll see better results with individual residents with increased one-on-ones than you ever will with increased special seasonal thematic recurring events, those big parties, those large group, those classroom settings. Those don't work as well as that connections that we have right now to use to help improve the quality of life for our residents. Any questions?
Okay, let's see. I have a question.
Sure.
You mentioned that this is going to be the new normal, and I'm just curious. Have you? And some of the first of all, you've given us some really good ideas, so thank you for that. And I think a lot of people on the call are going to get some good things going because of your presentation. But I'm curious in terms of what have you done so far at CC Young in terms of some of the things that you mentioned, like the corporate volunteerism. Have you tried that yet, and how has it worked?
We have not tried the corporate volunteerism. One of the things, just because the corporations are not back in their offices yet. So until they release and they go back to work, we can't do that yet. But what we have been doing is connecting to our existing volunteers and giving them opportunities to do things because we don't want to lose those existing volunteers. They go, oh, I haven't been volunteering in a couple of months because of COVID, so I'm not going to do that anymore. No, we need to be sending letters out, thanking them for what they've done and giving them opportunities to help out. For example, we have a cross that was donated by Lovers Lane United Methodist Church out front, and it's covered in flowers. It's one of those chicken wire crosses. And one of our routine volunteers comes out every week to put more flowers on that cross for us. We have some of the volunteers coming out and dancing through the windows and showing off those kind of things. Of course, they're making cards for us. They're making posters that we've hung all over the wall, encouraging notes. One thing you can ask for is pictures of the loved one with their pet. pets are a great thing for the residents to see. And the same thing, if you're having Skype times with a family member, get that pet up there, get those kids up there, because as we know, pets and kids are one of the most important things, and the most, it'll make the residents much more alert using kids and pets than it will a man sitting there playing the clarinet.
I guess another question would be, with basically the entire country on lockdown, or have been for the last several weeks, are you seeing more virtual meetings now than you would have if otherwise?
Oh, absolutely.
Yeah.
Absolutely. The bulk of our programming right now, every day we do at least 10 virtual visits between family members and residents, virtual visits on the large screen where we'll pull 3 or 4 people in 6 feet apart, especially for the ones that are fall risks that really, really don't want them in their room. We'll set them up in the living room 6 feet apart and show Skype visits with their child. We had one where the child was throwing snowballs at the camera and the residents were throwing snowballs at the television. So really interactive opportunities. So we are seeing that a lot more than we are anything else.
Do you limit those presentations or those visits to a certain time period, or just to schedule them?
Yes, we have limited those. Right now, we're doing just a couple of times a week, but one of the things that we have to do is we have to play to the residents' strengths. So we have a couple of residents that, of course, are in our health center that are not very alert during the day. They never have been before COVID, and they're not now. So we have to find times when John's alert, red alert, John's alert. So we grab the phone and we call his mom or his wife and say, hey, John's alert, you want to talk? Oh, absolutely, let me talk to him. So we have to kind of tailor those person-centered care to when that resident is ready to connect and be involved. So that is one of those things that if a person's having a really good week, we might visit with them more often.
Okay, those are great points. Does anyone have any questions they'd like to ask Kaylee? You can unmute yourself or you can type something into the group chat. Where can we find more info on creating your own channels?
I can add that link. I can send that link to Amanda if you'd like, and we can get that out to you.
Okay, great.
I'll do that.
How do you have, in terms of your own channel, do you have like regular programming that you put on during the week, or how do you use that channel?
Well, we have the luxury of having a arts and education building, and the staff there is not leading any events right now. So they are completely taking ownership of our in-house TV channel. So we have something going on all day, every day. In between events, there's sometimes a fish tank being shown with beautiful music playing. But we have entertainers, we have interactive games, all our exercise classes for independent living are all going on that channel. Our chaplain's doing a Bible study and a devotional every day. We've got one of our speakers who does mindfulness. So once a week we have a mindfulness time. We have our book reviewer is submitting videos. And what we're doing is we are linking that television channel to Facebook, and we are showing those Facebook videos. We are showing videos that have been emailed to us. We are showing YouTube videos, and some of them are like our Tai Chi guy was here every Monday. Now he's here, air quotes, every day because he is doing that on the channel for us. And that's lovely that we are doing all that and we haven't had to pay for any of that because they are all donating it. And YouTube is so huge. You can find anything on there. Just make sure you proof it, because I've had some issues where I've gone in to proof a video and watched it, and at the end there was a big giant cuss word being shouted out. So make sure you proof those videos before you post them.
Okay. Good point. Have you used any of the technology to link residents to each other if they're in different buildings or?
Absolutely, yes. Right now, we have a resident in long-term care, and his wife is up 3 floors above in assisted living, and the two of them talk a couple of times a week because he's one that we have to find when he's alert. And so if he's alert, we'll definitely pull him in, just because she said to me, my biggest fear is when this is over, he won't recognize me.
Okay.
So we do what we can to keep that from happening.
Great.
Hey, George.
Yeah, Russell?
Hey, it's Russell Cruz. How are you?
Good.
I had to get on and watch Haley. I wanted to also point out one of the things we've learned from our nonstop broadcasting on our TV channel of all of our programming is some of our residents that were reluctant to come to some of our exercise classes actually have become engaged by exercising in their apartments, watching TV when they wouldn't do it before. So it's probably going to change how we approach how we engage all residents on campus, because I didn't realize some of them wouldn't come to the exercise classes because they just didn't want to be exercising with other people, but yet they'll do it in their own apartments.
Yeah, there is definitely going to be, we haven't talked a lot about the future and what it's going to be like, but it's probably going to be, you're going to have to simulcast a lot of stuff that wouldn't do. So.
Yes, thank you, Russell.
So we're going to start evaluating that as we go forward here. But we have an extensive array of programming every day on TV, so it's pretty impressive, actually.
Yeah, that's great.
One of the things we're talking about, the cross-campus connection, is things like we have a couple of programs every Friday where we have residents from independent living and assisted living, and actually we've had memory care too, call in to play a trivia game, to play Wheel of Fortune, and bingo, and when they call in, we'll have residents from other areas on the campus recognize them. For instance, our memory care went, "Hey, that's my sister. How you doing, sis?" Well, it wasn't live. She couldn't hear him, but we were able to share with her that he was responding. And this was a resident in memory care who was able to recognize his sister's voice. So that's pretty awesome when they can make that connection across campus when she can't come visit.
Fantastic. Are there any other questions for Haley? Well, great. If you look at the chat, Haley, you did great, because all I see is great job, Haley. So fantastic. And thank you for your contribution today to our sharing the information. Got a lot of great ideas. So
thank you for having me.
Her presentation will be posted on as a PDF, and feel free to use that in your various communities. I'm now going to turn it over to Elise with an update on what's going on the regulatory and legislative front.
Hi, everyone. Hope you're doing well. Wanted to provide you some quick updates and allow you the opportunity to ask questions of us, policy, legal. Tell us what you need from us at this point. First, I wanted to just draw your attention to the new CDC reporting requirements. The rule was released on Friday and scheduled to be published on May 8th, which is this Friday, which would make certain reporting requirements effective immediately. We've been pushing out the CDC training module for those nursing facilities that have not enrolled. You want to make sure that you are enrolling in the reporting module and taking those trainings. There's various slide decks and FAQs. So want to make sure our members are aware of those. Just after this call, actually at 2 p.m. Central Time, CDC is hosting a webinar on enrollment and reporting in the COVID-19 CDC long-term care facility module. And you can register for that right now if you'd like. I don't think there will be any trouble getting into that webinar. with regard to state updates, the most recent document updated is the COVID-19 response plan for assisted living facilities. We've been working with the agency to make recommendations on how to improve that response plan. So there were several updates in the plan released just yesterday morning to assisted living facilities, and those updates are in red, so are easily identifiable, but happy to answer any questions on that updated plan. Last week, there were several questions regarding the governor's reopening report and the minimum standard health protocols for all employers and how that impacted you as you've been monitoring staff based on CMS and CDC guidelines. We received clarification. Well, I'll say we received word today from HHSC that they will be providing additional clarification. But Corey's on the line, and we were discussing this prior to the call, and he was going to elaborate a bit to provide you some guidance while we wait for that clarification. Is Corey on the line?
I'm here. Yeah, so looking at the issue in this interim phase of hopefully a day or two, maybe a little longer, is how to reconcile the governor's minimum standard health protocols for employers and the fact that there's some new symptoms in there that they're listing in terms of when you should send an employee home. They also talk about sending someone home who has known close contact with a person who is lab confirmed to have COVID-19. So one immediate area of tension that I see with that is that the guidance from CMS, HHSC has been for healthcare providers to utilize the CDC guidance on exposure. So for example, according to the CDC, if you have someone in the healthcare setting that has had a low risk exposure to someone with COVID-19, they can actually keep working. Now, I don't think the tension there is too great. What the governor's guidance says on this point in particular is that you're supposed to send someone home who has known close contact with a person who is lab confirmed to have COVID-19. You know, the CDC guidance breaks it into low risk, medium risk, high risk, and so, you know, I think what the governor is getting at there is probably something that would fall into the medium risk or high risk category. But in general, it does illustrate that there is not perfect overlap here in what the governor just put out and what we've all been learning about and what you've been trying to follow in the long-term care setting. And so in my discussion with Elise, my suggestion to her was to continue following what we've been following more or less. I would review what the governor has said about health protocols for employees, and if there's something there, you know, that you want to add in terms of, you know, okay, we'll be on the lookout for this symptom or that symptom, you know, that makes sense. But I would generally err on the side of following the guidance that was designed specifically for your industry, as opposed to these more general recommendations, again, with the hope that we get, you know, some additional clarity from HHSC very soon. And one other piece that I mentioned to Elise was that overall the CDC guidance, you know, for healthcare workers is premised on having and utilizing PPE to a very high degree. So to the extent that that is still a challenge for you, I do think that makes the governor's orders, I'm sorry, these aren't orders, these are really recommendations. That makes those, that's a differentiator there. So to the extent you're still operating, you know, you really can't meet the CDC risk guidance unless you have adequate PPE. So take that into account as you're deciding, you know, which to follow. At least that was what I had on that topic.
Thank you. I have a couple more updates, and then I'm going to kick it to you, Corey, to talk about the PPP program.
Okay.
So another question that's come up as we see cases increase in nursing facilities and long-term care facilities was the ability of providers to access some type of real-time updates on confirmed cases nearby, so you have an opportunity to respond accordingly and better monitor staffing and implement any type of heightened measures that may be appropriate. There's concern around some type of written information released across providers, and I think for several good reasons. But there was a recommendation, or I guess an offer made by HHSC that may provide you the opportunity to get more real-time updates on confirmed cases at facilities nearby. If you would like to, you are free to contact your regional director or program manager on a weekly basis is what was recommended, just due to the amount of incoming calls and survey response. So if you'd like to reach out to your regional director or program managers to ask for a status update on confirmed cases of facilities near you, HHSC did oblige and will be instructing those staff to provide you with a very high level update. So if you've been having difficulty accessing that information, locally, whether you're talking to different providers directly, this may be an avenue to receive more information. There's also been, a lot of discussion and really requests made mainly by the media to individually list facilities, confirm number of cases, and that type of information. There is a request into the Attorney General's office by HHSC, as they've received dozens of requests related to making these lists public. We have not received any type of confirmation on whether or not some sort of public list will be made available, but did receive word today that it's likely any type of public reporting would be aggregated data versus individual facilities being listed. And we're, of course, advocating that if this type of information is released, that it's comprehensive and includes several data points, including number of recovered cases as well, and obviously updated as best as possible as things change on a daily, on an hourly basis, really, across facilities depending on their circumstance. I wanted to provide just a quick overview of what we're seeing with regard to the governor's activation of the long-term care mitigation plan and the addition of the rapid response task force that has been deployed. So for those of you who haven't had to go through this process yet, once you report a confirmed case to the local health department, someone from the local health department would come into your facility to conduct an assessment and make some sort of determination focused on testing based on your circumstance. HHSC would then be called to come in and survey and perform their assessment of the situation. At that point, they have the ability to deploy this rapid response team to assist with testing, staffing shortages, PPE. We were told today that this task force is not deployed in all situations, but would be deployed based on the needs of the facility, mainly with regard to testing. This task force may be assisting there. But what was not clear in the mitigation plan released by the governor is application of this in assisted living facilities. It is applicable to assisted living facilities. So if there is an AL that reports a confirmed case, you may very well see, the deployment of this rapid response task force. And based on what our members have experienced thus far, we've really emphasized the need for clear communication. So you as a provider are aware of everyone's role and responsibilities, as you could potentially have 3 different teams of people in your community to assist once there is a confirmed case and testing needs to be conducted. So we are here to help all providers throughout this process. If you find yourself in this situation, have questions, you need answered, or unclear about certain things being communicated to you by each of these teams, please don't hesitate to reach out to us, and we'll assist as best as possible. And the last thing I want to note is today at 2:30, the governor will be holding a press conference, including the new executive commissioner of HHSC, and they will be speaking specifically on this rapid response team. So we'll certainly report out on what is shared at the 2:30 press conference. Within a few hours, I'll get a communication up on the resource page if you're unable to attend, but we anticipate some new updates this afternoon. And that's all I have.
Thank you, Elise.
Sure.
Yeah, the things seem to change by the minute. These rapid response teams, unfortunately, some of our members were guinea pigs in that when that started last week. So they had to endure some communication problems between the agencies. It's obvious to us that HHSC and DSHS have not worked together for that very long in terms of this whole issue. So there's some learning curves that are in process here. So patience is required. I'm going to turn it over to Anne. Do you want to give us an update on what's going on with PPE?
I know we're working hard on several different avenues to get PPE to our members, but I'm continuing to research companies for you as well, so it gives you another source. I mentioned last week that we were going to be sending a weekly PPE update, and that is going out this afternoon. And these are companies I have announced in the past. I'm just updating you on their availability. So we're monitoring who has stock and who does not. I would encourage you to look at that when that goes out later today, because we've got some improved pricing on KN95 and surgical masks for you. So in addition to masks, we'll have gowns on this announcement, boot covers, thermometers, and hand sanitizers for you. Again, we'll continue to send out new updates and those updates that come from Value First. But this particular update will go out on a weekly basis, and just know that I'm checking stock for you routinely. Also, one other thing that came to my attention today is Cisco for your food departments. They are providing us with a weekly update on food shortages that are related to the plant shutting down. They are beginning to see some things impacted there. So those of you that are using our Value First Cisco program, you'll be receiving that update today as well. And we have requested an update from US Foods, and I will be getting that out to you as soon as we receive that. Also, for those of you that participated in the aggregation, mask aggregation, community aggregation order that our friends at Christian Care helped us with, that order landed. It was delayed, but it landed at LAX yesterday. I just got a note that it has cleared customs, and they expect it to clear the FDA within the day. So those orders should be going out this week. So that's long awaited. I'm glad to get that update. And as always, if there is product that you need help with that I haven't mentioned, please feel free to reach out to me directly. I'd be happy to help.
Thank you, Ann. I also have another update on PPE. The two associations, LeadingAge Texas and Texas Healthcare Association, has been working with the Texas Medical Association in terms of distributing PPE. The TMA set up a portal where their individual physician practices can order PPE. It's then delivered through the RAC, the Regional Advisory Committee, that gets the PPE and then sends it to the county medical societies, and then the physicians are able to pick it up there. So we're trying to figure out how to best do this. It may be, picking it up at the RAC level, but figure out what the best way to distribute it. There's about 20 or so racks around the state, so it may require some driving to get there. But you should have an announcement from us sometime later this week on the whole portal on ordering PPE. I will tell you that the Medical Association tried this out last week, launched it last week, and in certain areas, and it seems to be working pretty well in terms of getting some supplies. Now, much like us, they still are not getting everything. For example, I know that they still are not getting enough gowns, but at least for the N95 masks and the face guards, all those things seem to be in better supply than they have been for a number of weeks. So they continue to sort of ramp up the whole PPE supply chain. So as I said, you'll be hearing some more about that. Also,
George, go ahead.
Okay, so Ann, did you have something else on that? No, okay. All right. Couple other updates. Again, I mentioned this at the very beginning. May 21st, we're having our virtual conference. This is an opportunity to get together with all your friends from around the state. 2 hours of CE will be provided. This is a free event. We'll have our keynote speaker, Karith Foster, who's going to talk about pivoting to your purpose, which I think is very apropos for these days. And then we're going to hear some solutions from some of our business partners, and then a virtual town hall with LeadingAge National. So, and followed by a virtual happy hour. So hope you can all join us, and make sure you register for that. Next week, Ziegler is going to be our speaker for our Tuesday call. And for those of you in the RRG, if you can just stay on the line and we can start that meeting in a few minutes. But in the meantime, are there any questions?
George, this is Corey. I had just wanted to talk about one other item briefly, if that's okay. one question that we received recently, and which is something other folks may be looking at, is about the PPP program and the fact that the SBA announced that it was going to audit every PPP loan over 2 million, and also requiring a certification from those that take the loans that say current economic uncertainty makes this loan request necessary to support the ongoing operations of the applicant. The SBA, basically, everyone kind of knows the background, which is that there's been some blowback on certain companies taking these loans, particularly public companies. The SBA didn't provide a ton of guidance on these new requirements and this new proposed auditing. One thing they did say is that that public companies with substantial market value and access to capital markets will likely not be able to make this certification in good faith about not having access to basically needing the loan. And so just as a general recommendation, we do think it's important to do some documentation of your evaluation of your need for the loan, and the fact that you did at least consider, your existing access to credit and your existing loan arrangements that you could potentially borrow under. I think it's probably unlikely you're going to find anything, or have access to anything that is, you certainly won't have any access to anything forgivable. But just in kind of the spirit of this guidance and being prepared, we don't know, what these audits will look like and what they might say to people that took it and what the ramifications will be. A lot of unknowns, but again, just making sure that, as you prepare to move past, there is a date that you could return the money on if you felt like this was not the right move. And as you move past that, just being prepared to show that you did look at your, existing access to credit, thought about that, and that this was a well thought out decision, would be good to have in the event that there's some later effort to say certain companies, beyond those most egregious ones, shouldn't have taken these loans.
Hey, Corey, I've got a follow-up question. I
Yeah.
thought that the loans, the PPP loans in particular, were forgivable if the funds were used specifically for payroll, to pay for staff for X amount of weeks. Is that
Right? Yeah, that's still the case, and yeah, absolutely want to follow those requirements on, the amounts that are supposed to be used for payroll versus, the 25% that can be used for some other items. But yeah, I think you want to follow those guidance, that guidance. B, just know that there is, in addition to that, there's been talk and guidance from the SBA saying, well, some people shouldn't have gotten these because they could access other debt or other sources for capital. And so, in addition to following those required usages, showing that you did in fact need this, having some documentation to support that would be a good idea.
Okay. Elise just posted an update on the FEMA PPE issue. Elise, do you want to speak to that really quickly?
Sure. So we requested individual facility allotments from the state. We haven't been able to access that information, but we know those shipments are being calculated using staffing and census data. And the alert that just came through on GovDelivery says FEMA will be coordinating 2 shipments totaling a 14-day supply of PPE. It says that the first shipment will occur in May, and then the second shipment will begin in early June. And like we mentioned last week, these shipments are being prioritized, and there have been several cities and regions identified as priority. You may not be receiving a notification when these shipments are coming. They may just arrive. So we'll be interested to get your feedback on when these shipments start coming in and how it's working and what that's looking like. But that was just put forth, or that was just sent out maybe 10 minutes ago on Gov Delivery.
All right, thank you, Elise. So, oh yeah, please let us know if what your experience is and what sort of supplies you got from FEMA and whether it's useful. So that's all things that we'd like to know so we can feed that back through LeadingAge National. All right. Well, thank you all for joining us. Again, for those RG folks, if you can just stay on the line. Otherwise, we'll see most of you next week. Thank you.